welcome to this week's episode of Business Solutions, where we provide solutions on formed lifestyles. My name is Kingsley, Oluoko, and today I'm joined by the CEO and founder of Afya Dynamics Ltd. He'll be talking to us about the solutions he's providing on AI and digital solutions through cutting-edge solutions that enhance patient management, streamline hospital operations, and enable better decision-making through AI-powered analytics. Karibu sana sir, and welcome to this week's episode of Business Solutions. Just let me know what inspired you to come up with Afya Dynamics Ltd.
First, thank you, and thank you for having us on the show. Afya Dynamics was conceived from a need in the market. We were approached a couple of years back by a hospital to help them streamline their operations, and we saw a need that the problem they were facing, many other healthcare facilities were actually facing. So we decided to come up with Afya Dynamics.
Yeah, and talking about Afya Dynamics, there is a huge play on tech. Give us the background on how tech is helping you provide solutions to hospitals, local pharmacies, labs, and the patient themselves.
So Afya Dynamics is a health tech company. So we use tech to enhance patient outcomes, and our flagship product is the Afya Dynamics OS, which is a healthcare management system that enables hospitals to run their full operations, from recording patient data to recording their inventory, to their purchases, to their HR. Everything is covered on the system. This goes into pharmacy, helping them manage their inventory, and also for labs to help them manage their tests and reports and ensure that there is accuracy. For the patient, we offer a mobile app. So first, we've democratized the data, that patients no longer have to ask data from the facilities. Patients own their own data. So anything entered on the Afya Dynamics system is owned by the patients themselves. And we give them a mobile app and a web platform where they can get in, download their test results, send them to other doctors, and also find facilities within our networks.
That's a clear description of what you work. I mean, we are coming from from a point when tech wasn't there, and so records used to be in books. I mean, calculating or writing in records who walked in, maybe a facility like a hospital, their diagnosis, then they come to the medicine, and even when they should come back for a checkup. Give me what you are bridging in this gap. What is the gap that you saw, and now you are bridging through this tech?
So first, we can't ignore that that's how largely health tech has been operating. So medical facilities have mostly been doing their records manually, but there is a whole slew of problems that comes with that, and one of them is data consistency. So having data move from one department to the next department is a bit hard when there's a physical file, as opposed to when a facility has automated their processes and it is on one system where everybody can access. So there's that kind of data consistency and also data accuracy. So a while back, when you're doing manual records, if you're giving a diagnosis, let's say you're giving a diagnosis for malaria, you'd have to come up with it from your head or from reference books. But now with a system, we have integrated with, for instance, the International Code for Diseases, ICD-11, whereby every diagnosis that is given is accurate and is a diagnosis that is consistent across all health facilities in the world. So there is that data consistency that comes with now automating your records.
Okay, and so we are talking about a software that is can work in different spaces. Maybe you could just mention to us how is it able to manage all this data that is coming in, process it, then getting certification from the institution that you've mentioned, and even just to be consistent with what the market needs.
Yes, so Afya Dynamics is what we call a full-featured HIMS platform. That means it encompasses every department that a hospital has, may it be theater, may it be pharmacy, laboratory, inventory, ward, inpatient, everything that a hospital might be needing to run its operations. It's actually encompassed in the HIMS platform. We have standardized it to ensure that it is consistent. First, for many facilities, they don't understand that there are so many laws and policies that affect them, that have been infected actually in the recent past. Something like the Data Protection Act, there are some things that are required for healthcare facilities when it comes to data protection that our system does right off the bat, like requesting for consent, making sure that the data is stored in the country, making sure that the patient has access to all their data and they can request to their data to be deleted. All that is accessible on the platform, and it kind of helps the facilities with compliance. So we are registered by the Office of the Data Protector for that matter. When you look at things like the Digital Health Act, the DHA, that has also other requirements that facilities might not be aware of. So there are some reports that facilities need to report directly to the Ministry of Health. There's some data that they need to be sending to the DHIS, District Health Information System. That also is done right off the bat on our system. When we look at compliance with things like KRA, so with KRA there has been the introduction of eTeams platform. Many hospital facilities don't know that the invoices they generate have to be eTeams compliant. Our system again does that out of the bat and helps the facilities to actually be compliant. So one of the benefits that a facility might get by using Afya Dynamics is by ensuring that the laws that are being passed for in terms of the data they should collect and how they should collect it, we're able to cater for that right off the bat.
Okay. Yeah. I understand how you have been able to get good partnerships through governments, the state agencies, to enable you facilitate such kind of solutions. But even before we speak about the onboarding process, I'm a patient, I want to use Afya Dynamics for an array of issues. I want to understand how AI plays in Afya Dynamics Ltd.
So AI is on our platform, powers the analytics. So we're able to generate several reports that are relevant to the facility. For instance, where are your patients coming from? What ailments are your patients facing? What kind of remedies are you using the most in, let's say, the lab or the pharmacy? How does that data relate to enabling you to make better decisions? Also on the doctor side, so the doctor has put in a diagnosis, this person has malaria as a diagnosis, right? The system is able to use GPT algorithms and give them a recommended treatment plan that they might be able to look at and follow and probably help them give better patient care. So the integration of AI into our system is really crucial in terms of we are looking into the future, into reducing the workload for the doctors, helping them make better decisions and eventually improving their patient care.
Okay, what is the success rate, accuracy? Because I mean, we're still receiving emails with a dash. You just know that it's an AI generated email. When they're telling you no, you'll not be accepted into this position. What is the accuracy of using charts, or rather GPT algorithms that you've mentioned, to giving a diagnosis?
So you'd be surprised at how AI systems are accurate. For instance, AI systems are about now 95% accurate in reading slides and being able to give cancer diagnosis, way more accurate than human doctors, right? Because you have to understand how GPT is built, right? So a GPT, before it's able to give you the responses with the dashes, which is just its own kind of like style of writing, right? It reads a lot of data, right? It gets to consume a lot of data, way more data than we can actually be able to consume, right? And even the way the human brain works, a doctor is able to make reference and say this is cancer because of the data that they have actually consumed through the years. So you're thinking of something with the ability to consume petabytes of data that then it uses on neural networks, similar to the way the brain works and its neural networks, and make the same kinds of decisions. So on our platform, there is a disclaimer in terms of we won't give you the diagnosis straight from AI. It's human. It's a human being who will give that diagnosis. But the AI enabled bit is that it helps them make a faster decision and gives them all the possible outcomes that may be present.
Okay. Let's move to the diagnosis part. You are talking with hospitals, you are talking with pharmacies, and numerous of them that we have in the country. So how are you able to, first of all, before even you come to onboard them, what are the compliances that you have to check so that you have somebody on board, even as we talk about the other vice versa, well, them they seek you?
So for a facility to onboard with us first, as opposed to other platforms, and I think this is really key to how we've built our platform, that our platform is really easy to onboard. We actually just require you to be a registered medical facility by KMPDU. Once you're registered, KMPDC,
yes, the council.
So once you're a registered facility, you can go on our platform at afyadynamics.com. You can register yourself, put in your facility details, upload your patients, upload your pharmacy records, upload your services, and you can basically onboard yourself directly. Training videos are available, and we've kind of tried to make these as software as a service, so to actually bring down the costs of acquiring the system and enable the facilities to onboard themselves and onboard faster.
To a patient?
So to a patient, the Afya Dynamics app offers a wide range of services. First, it enables you to get your data, as I had mentioned earlier. So that has been a really big issue, because you'd get a test done by a facility, but they don't want to give it out to another facility. On the app, once the test is done on our system, you can download it and it's yours, because the data, to be honest, is yours, right? But then a patient can also, even without visiting one of our facilities, they can onboard themselves on the app. They get it on either Google Play Store or Google App Store. They just get from search for Afya Dynamics. They install the app and they can immediately see a number of facilities that are listed there and that are closest to them. Now with our version 2 of the app, they're also going to be able to see doctors that are closest to them and organize for home visits, for on-site visits, and that's kind of an innovation we're doing in mHealth, and trying to get as healthcare to be as easy as you order, as accessible as you would have to order, let's say, a pizza online. You can get a doctor, get a diagnosis, and things like that.
That is really brilliant. I'm telling you, I can get my doctor on the phone. You are doing an amazing job. I want to talk about the payment method. Currently, we have an issue with the rollout of the Social Health Authority, which is now contributing. Kenyans are contributing at a certain fee. Also, we have the individuals who are not salaried, so the Kenyans informal sector. Apart from footing the bills, medical bills through out of pocket, how is the insurance playing a part, and how have you integrated it in your system?
So as I mentioned, we are integrated with DHIS and SHA, so we are able to register patients who are contributors into the SHA scheme, right? And then they can get pre-authorizations and they can get services on our system, straight from our system, without using a different system, right?
Going back to the SHA system, or to look if it is...
if this person is eligible, you get that straight on our system. Also, we're integrated with Smart Healthcare. Smart Healthcare now covers all the other private insurances. So you're coming with Jubilee, you're coming with APA, with CIC. All those health covers are integrated with Smart, and we can get to see your member status directly on our platform and get those details. So for the hospital, the value they get by using Afya Dynamics for insurance billing is that they can also make claims straight from our system. So they can send claims to SHA, they can send claims to any private insurance, and they can get statuses of their claims. Have they been paid? Have they been approved? Have they been rejected? So they can do the whole claim management through insurance through the system.
Wow, that is brilliant. I'm telling you, we want to talk about the challenges that we have with SHA now. For example, I know this is really off the cuff, maybe in this conversation, because you are just a channel between the service provider and the patient. But how do the challenges of maybe certain pending bills, particular hospitals, affect the operations for your business?
So, pending bills are a big factor for our business, because we depend on the revenue facilities get to actually pay us for the use of our software. But I will also have to say there might be a lot of misinformation when it comes to SHA, because SHA is like any other insurance scheme. The only thing that made it controversial is that it removed the previous contribution plan, which I also actually thought it was pretty low. and then they brought in the 2.75%, which is, I think, is at par with global standards. So that means that they get a bigger chunk of money. And as far as I've seen, the delays are at least better than NHIF. In terms of payment for facilities, the delays are not as much as they were during the NHIF. What is delayed and what facilities are worried about is that they are still owed billions of shillings from the NHIF scheme that was there. And that means that they can still run the operations because they had counted that as revenue in their books. So if the Digital Health Authority would actually settle those claims that are still pending from NHIF, then I think the process would be a bit smoother.
Okay.
Yeah.
That is brilliant. You are talking like a government spokesperson for a moment.
I know. I know, but you have to understand that there are problems with SHA, as there are problems with many insurances. The problem is now they are not running it like, NHIF, there was a lot of loopholes, and there was a lot of ways that fictitious claims would be approved on the system. Now they are very stringent matters, which is the same way you get with private insurance. Like if you're talking about private insurance and you're telling them you have a tumor, you have to ask how big is the tumor, what centimeters is it, we only cover up to this much. So those are the same rules that have now been included into SHA, which is good in terms of like the fictitious bills are not there anymore. They are way fewer if they exist at all. But it's also bad because it's a social thing, right? So telling somebody that your tumor is not big enough to actually be covered under SHA, then where does the social health come in?
Listen, we cannot bypass the fact that connectivity and even tech has not penetrated to a wider market in Kenya, and that's a challenge to you. Talk to me about how you are handling or wishing to tap into the rural-based hospitals or even Kenyans.
So I'd surprise you to tell you that the rural-based hospitals are actually some of our biggest clients.
Oh, really?
And that's because they've been ignored so much by the major players. In terms of the tech I need to reach the rural areas, the biggest bit was internet. And internet penetration in Kenya is very high. It's among the best in Africa. That means facilities in the rural areas can access internet because our system, Afya Dynamics, is cloud-based. Also, they can be able to get machines, due to Moore's laws, of course, the machine prices have gone lower and lower as we go on. So now to equip a hospital, let's say you want to buy 10 machines, you probably need to spend around 200,000 shillings, which for me is not as prohibitive as it was while we were starting out.
So you kind of feel there is a white smoke, how do you call it? There is a hope that is coming in connectivity and tech. That's really good to know. The other thing that I would wish to ask, or rather to even put forward or just assure your listener, is that you said that you have been you have an accreditation with the ODCC, the Office of the Director of Data. But then still, I know someone wants to get assured that data is private, because I'm getting to key in my diagnosis or what I've been suffering, or even just a symptom that I'm going through, which I kind of feel I will not wish you to know. How are you able to secure the data and just know that it is protected?
So there are a couple of levels. Number one is being registered by the ODPC. So now they know we process patient data. That's within their knowledge, right? Number two is that they have a guideline on how hospitals and health EMR providers should actually handle patient data, and it's pretty stringent, and the penalties, the threat of the penalty that we face is very high. I wouldn't dare give out somebody's diagnosis, and so does my team. So we've done training with my team, and they know what information is really private and what they should not even touch. Then on our system, we have what we call access controls, right? So this system is being used by medical doctors, it's being used by HR representatives, it's being used by marketing representatives, right? All these people don't have access to the patient file. So there are those levels of access. So for you to get the diagnosis of the patient, the doctor actually has to give you the right to be able to see this diagnosis. So that puts the onus on the person who's entering the data to be the one to share that data, right? But we are faced with challenges with the training that the hospital staff have, and we are trying to bring on training programs on Afya Dynamics for hospital staff on how to handle patient data, because of course patient data is very sensitive. But at the end of the day, we can only do so much. So we're trying to seal all the loopholes, but mostly the human aspect of it presents a real challenge. Yeah,
that is really brilliant. I want to also understand about the new project that you're coming up with, integrating doctors into the system. How is that going to be possible?
So Afya Dynamics is trying to introduce an mHealth solution, and we are still working out the legal issues, because there's an mHealth policy by the government. There's also an eHealth policy by the government. We're trying to see with our lawyers if we are compliant on all fronts. Then we will be onboarding doctors, doctors in facilities, specialists, doctors who have private practice. We onboard them on the system. And we're actually introducing chat with a doctor, which will be free on our app. So you'll get to talk to a doctor, and a doctor will give you diagnosis. So a qualified doctor with their license, they'll give you a diagnosis, they'll give you they'll order for you tests. And we are trying to see if we can partner with organizations that do door-to-door testing of patients to actually get the services closer to the patient. We're also introducing video chats with doctors at a fee. So you'll be able to video chat a doctor close to you, a specialist, get to explain yourself to the doctor, and the doctor books for you an appointment either for a physical visit, a lab work that you might need done, or even prescribes for you a drug based on the diagnosis that they've gotten. Yeah.
Wow, I can't wait to look up to that. That looks a bit complex, but it's doable.
Yeah, so I'm gonna give a disclaimer, and for probably the government officials that might be listening to us, we are not yet there. That bit of right now on our app, you can get medical facilities, and you can book appointments and book services, but the doctor bit presents some bit of challenge, because there are some policies that say we have to register as a medical facility to offer that kind of service.
Because now you're coming in as a hospital.
Yes. So there's a lot of regulation that we have still not worked out, but we are hoping by the end of the year we'll be able to launch that product.
Yeah, and you go forward anytime. I want to talk about e-migration. I'm telling you, the rate at which Kenyans are going abroad to seek medical attention is an alarming rate, as well as getting medical attention, medicine from India, from UK, to get healing or curing for their diseases. How is that possible, and how are you integrating hospitals abroad to your system?
So medical tourism has been there for a while, and there are destinations such as India, Turkey that have been a stronghold of medical tourism. And I do understand it's because of the specialists, right? So in Kenya we do, I wouldn't say a lack of specialists, but the numbers are not as many as you'd like. So if you're looking for, let's say, a cardiologist, there's probably one per county, right? If your county has 2 cardiologists, then you're a very lucky county, right? So you find that the pricing also for their services, because it's an open market, the demand and supply, right? You find that India might be a cheaper destination because they have more cardiologists for taking care of your heart, right? So that is there, and in the future probably we do intend to integrate maybe with healthcare providers abroad, but that has not come up in our product roadmap as of yet.
I hope we also come up with daktari wa heartbreak.
They're actually there, by the way. I think they're called psychologists. Should see your psych.
Listen, we are getting to the tail end of this conversation, but I want you to mention to me about the future. I know you've mentioned about integrating the doctors, but somebody's listening and they want to know, did you study medicine? Did you study tech? Where are you? Or is there a biotech course like?
Yeah, so me myself, I'm a computer scientist.
Okay.
That's my training. And I say I stumbled into health tech.
Okay.
So when I was starting out, it was really a need. A facility had given us a need. They want a system built, right? And at the time, we were the most affordable option for them. And we got to learn that way. So we were able to build our version 1. We were able to again build another version 2. Right now, we're on version 3 of Afya Dynamics.
Wow.
Which is a bit more complex because we have now brought in healthcare professionals to actually give guidance on how the software should be built.
Okay.
Yeah.
That is amazing. So somebody wants to onboard, a client is listening.
Yeah.
Let them know how they do that.
So first, thank you for listening. Second, it's really easy to onboard on Afya Dynamics. As I said, we are trying to be the outliers in this market. So if you're trying, the biggest issue of onboarding into EMRs in Africa is actually costs, because the average EMR will cost you around 32,000 USD, or around 4 million, and those costs are unbearable, especially for small healthcare facilities. And again, we do appreciate that the healthcare industry in Africa, the backbone is healthcare facilities. So us, we're trying to offer Afya Dynamics as a software, as a SaaS product, right? Software as a service product, right? So all you need to onboard, we have different packages. We have the light package, which goes for $2,500 a month. That's around $20. We have the standard package, goes for $5,000. We have the pro that goes for $10,000, and we have the enterprise that goes for $20,000, right? So all you have to do is go to our website, www.afyadynamics.com, find a package that fits you, sign up, put in your facility details, your patient details. We give you a 14 days free trial to try out our product. And in those 14 days, the minute you sign up, my team will be on you. They'll be calling you, trying to train you, trying to get to know your needs, and trying to onboard you into the service. So it's really easy to onboard. You actually don't even have to call us. You just need to go to our website, again, afyadynamics.com, sign up, choose a package that fits you. If you're not ready to commit, get your 14 days free trial, try out our product, and then we can onboard you.
That cuts across for both patients, labs, hospitals, and pharmacies?
Yeah, so for patients, it's free. Getting on Afya Dynamics, the app, is free. You can book a service there. You can book an appointment for free, or you can book a service at the rate that the facility is offering it at. So we are not charging anything for the app. For pharmacies, labs, and medical facilities, the rate is the same for all. All we differ is the number of users you want. So if you want 3 users, you're probably on the light package. If you want 20 users, you're probably on the enterprise package. Yeah.
Listen, heartbeats can't wait. Neither should hospitals. You heard it from the CEO and founder of Afya Dynamics here on Business Solutions, where we provide solutions on formed lifestyles. My name is Kingsley Oluoko. See you next time.